And this is a really interesting topic, strength and resistance training in the pediatric and young athlete. And when I say pediatric and young athlete, we're mostly going to talk about 7 or 8 years old up and through adolescence and high school. So, to define strength and resistance training, because we'll also talk about weight training as a competitive sport, but we're talking about increasing someone's strength, your ability to produce and resist a force. It's most often used with weights and machines, but there are tons of equipment and different things on the market like TheraBand and Swiss balls and TRX and ropes and who knows, but basically you're trying to improve your strength and your ability to resist force. It's typically at a submaximal level, so that means that if I can bench press one time 100 pounds only, then I'm going to resistance train at some percentage of that maximum press, maybe 60 or 70 pounds. Most of the research in young resistance training is, like I said, between 8 and 18-year-old children, but also as young as 4 and 5 years old, I found in my lit review. So it's a really interesting topic, and more children are engaging in strength and resistance training as part of their overall sport participation. So then here is the competitive sport, which is weight and powerlifting. So the difference is that weightlifting, you're working at maximal levels. So most people are exposed to this when they watch the Summer Olympics. And this is actually, if you can notice on the green dumbbell, Singapore 2010 was the inaugural Youth Olympics. So from here on out, every 2 years there'll be a Summer Olympics and a Winter Olympics, specifically for 14 to 18-year-old children. And that is, the top picture is Jessica Beach. She was the American weightlifter, the only American on the team who participated in weightlifting. The whole team was about 82 children, but she is 16, at the time 16 years old, from Oklahoma. And I forget exactly the weight, but I think she did place 7. And she weighs about 63 kilograms, and I think she ended up doing something about 90 kilograms in her max weight, which is amazing. And I believe that was the gold medal winner at the Singapore Olympics. But this is a competitive sport I had no idea really existed until I started doing my research for this topic. And there are national competitions as young as 13, 14-year-old kids are participating in the competitive sport of weightlifting. But the good thing about it, not a lot of evidence, not a lot of research, but the good thing is that if they are participating, it is a very well-supervised sport, and you really have to master the skill in order to participate in it. So far in the very early literature, there's not a lot of evidence of injury. But for the rest of this talk, we're mostly going to talk about strength and resistance training that we've been exposed to and our children are exposed to at schools and YMCAs, and et cetera, et cetera. So here are the benefits of youth strength training. It improves the cardiovascular profile, risk profile. It improves bone health and bone density. It can improve strength and motor control. It reduces sports-related injuries, and it improves mental health and overall sense of well-being. And there are a lot of old-fashioned mantras and old-fashioned thought processes with youth resistance training, and we're going to go through those and really just discuss the evidence, what it really does, what really happens to young athletes when they do a good supervised strength and resistance training program. So one of the old thought processes was strength training can have an adverse effect on your cardiovascular system, but actually it's been shown over and over in the research to reduce adipose tissue, reduce circulating blood lipids, and improve insulin sensitivity. And I don't know if you can read that little chalkboard in the background, but it says, don't limit your challenges, challenge your limits. And research not only in young athletes, but in obese children, resistance training is a really great adjunct to their overall exercise routine. They tend to become more compliant with it because it fits their attention span. You do one exercise for a couple of 30 seconds, you move on to the next one. It's easier on their joints, so a good strength and resistance training program should be a part of any young athlete, but also any child exercise regime, exercise program. Improved bone health. So the old thinking or the rumor was that strength training risks injury to growth plates and stunts overall growth. And in the Journal of Strength and Conditioning Research, in a review of the evidence in the literature back in 2009, they basically said injury to the growth cartilage has not been reported in any prospective youth resistance training study. and no evidence to suggest that training will negatively impact growth and maturation. And instead, we have repeated evidence showing that a good strength and resistance training program increases bone density and bone mineral content. Improves strength and motor control. So the rumor was that children cannot increase strength. Well, children, prepubescent children, before they have large amounts of circulating testosterone, can't necessarily gain muscle mass and muscle hypertrophy, but they definitely improve in their strength and overall motor control. And the theory is that, or the evidence shows that the improved strength is through increased motor unit firing and just a general maturity and fine-tuning of the neuromuscular system. And then in certain sport-specific skills, like a vertical jump, overall coordination, strength, and power are better in strength and resistance trained athletes versus their sedentary age-matched controls. Reduces sports-related injuries. So youth resistance training is unsafe is not true. There's actually a 0.7% rate of injury in youth resistance training. Now I have to say, as low as that is compared to I think 26% or something in the 20s for football, wrestling, gymnastics, there are definitely sports that kids engage in on a regular basis that have much higher injury rates than resistance training. However, this rate is slightly on the rise, especially in your high school level athletes. Low back pain, stress fractures, stress injuries in the spine. So we'll talk a little bit about that in a second. But in kids, so prepubescent kids, the injury rate is very low, very low. And most of the injuries are associated with, as you would assume with kids that age, improper use of equipment, inadequate supervision. But however, preseason strength and plyometric training exercise programs have been established in the literature to improve motor control, reduce the rate of injuries in pediatric athletes and young athletes. So there's definitely a realm of, or there's definitely a need for resistance training in young athletes. And then finally, it improves mental health and well-being. And I didn't find any old mantra about this, but evidence has showed that it improves mood and self-appraisal factors, which is good for young athletes, but also young children in general who might have some health issues or obesity, diabetes, and all of those epidemics that you hear about in the news every day. One thing I do want to say, though, and we will talk about this in a little bit, unethical or intensive training and inappropriate coaching could possibly have a deleterious effect with young athletes who are participating in a strength training program because of what we hear about use of steroids and prevalence of eating disorders. So I think any resistance training program in a young athlete should be discussed at the medical level with the doctor, physical therapist, or even the coach, teachers, the strength coach, realistic goals, realistic program implementation. You want to talk about the use of steroids and how harmful they can be, and you also want to talk about eating disorders and how to prevent them and avoid them. So again, realistic goals are very important, and in a sound resistance training program, you can actually have some mental health benefits. So general guidelines. Precautions and contraindications, the first three there, the pre-existing hypertension, chemotherapy, and the seizure disorders are precautions. And resistance training, you do not require a medical evaluation for young children to participate in a resistance training program. However, as a healthcare practitioner, I think every child should speak with a doctor and receive a medical evaluation first. Those first three are precautions and absolutely have to see their doctor first. The last three, 4, 5, and 6, have to be cleared by pediatric cardiologists before they participate in any type of resistance training program. So general guidelines, no weight or powerlifting. So that was like Jessica Bied, the Olympic weightlifter that I showed the picture of. No weight or powerlifting until reached Tanner stage 5. So the visible secondary sex characteristics, and they've hit maturity and they've hit their growth spurts and their growth plates are starting to close. They're at lower risk of injury at that point for those maximal weight routines, okay? Adult supervision by qualified personnel. I find this is probably where we're lacking the most when it comes to pediatric and young resistance training programs. I think athletic trainers, I think there are a lot of certified coaches and physical therapists who have excellent knowledge in implementing these sound programs, but then there are a lot of people who aren't necessarily knowledgeable about the topic. And so adult supervision by qualified personnel is very important for these programs. Education on proper use of the equipment is important, and for that reason, the American Academy of Pediatrics, American College of Sports Medicine recommend that you really don't start before the age of 7, because they need to be able to follow commands. Like I said, I've seen evidence in children as young as 5 and 6, but for a regular structured routine 2 to 3 times a week, about 7 or 8 years old is a good place to start. Again, general guidelines: you want to maintain adequate fluid intake and proper nutrition. Avoid pushing through pain and injury, and that's an important one, but that's an important one for all pediatric athletes. With resistance training, similar to any sport, if a child comes to you and they're complaining of a sore shoulder or a bad knee, don't push through the pain. Seek out a medical consultation at that point and make sure that there's no underlying real injury, serious injury. Any decent strength and resistance training program or exercise program for young athletes should include aerobic conditioning. And finally, let's go back to discussing realistic goals and make sure these young athletes, especially at the high school level, are educated about the risks of overtraining, burnout, how to avoid eating disorders, and also educated on how not to use anabolic steroids. Now, when we talk about the specific guidelines, what the research shows is that any good program should involve a 5 to 10 minute dynamic warm-up. So this is not you sat in class for 6 hours all day, you show up at the weight room and you jump right on the machines, or you stand there and do a stretch. You actually want to move a little bit. You want to get your blood pumping. I talk about dynamic warm-ups as priming the engine. You want to get your blood pumping, and it's going to reduce your risk of injury and also make your routine that much more effective. And even if this is just jogging in place, but dynamic warm-up is important. And then at the end of every session, about a 5 to 10 minute cool down, this is where you want to do your stretching and your cool down, okay? 2 to 3 sets of 10 to 15 repetitions is a very general guideline. Again, they want to be working at easier loads. They don't need to be working at that maximal load. And typically you want to be at about 60 to 70% of their maximum weight. Like I used that bench press example. If you can press 100 pounds maximally, then they're going to be working at about 60 pounds to start. And progression, as they get better, they only want to be adding about 5 to 10% of their weight over 2 to 3 weeks' time. Perform the routine about 2 to 3 times per week. Most importantly, include multi-joint exercises, and you have to focus on balance. So we see a lot of 14-year-old kids coming in with back pain from what they think their strength training routine, and you ask them what they're doing 7 or 8 abdominal flexion-based exercises and maybe 1, if that, back exercise. And so you want to make sure you include balance in your strength training routines. Educate the student athlete and the young athlete about core exercises and, again, functional multi-joint, multi-planar movements. And so here are some pictures I found online, and you've got some kids on Bosu ball. So if they're on a Bosu ball in that top picture, then they're automatically working all their joints, because if they weren't working all their joints, they'd fall off the thing. And they're working with TheraBand, and then you have your little guy with free weights overhead and machines. The bicep curl is a typical example of a single joint exercise, but then you've got the girl on the Swiss ball doing a plank, which is a great core and back exercise, and then the other girl sitting with horrible knee position, but albeit sitting on the ball, working her core stabilizers and weights in her arms, working her shoulder muscles. And I wanted to list these references because, first up, the Council on Sports Medicine and Fitness through the American Academy of Pediatrics is an excellent resource. Jot that website down. Anytime a patient, a young athlete comes to you and wants to talk to you about any type of resistance training or any type of sport participation, they actually have a lot of good position statements on young athletic participation. The next one in the Journal of Strength and Conditioning Research, that's the review in 2009 that I found a lot of my information from, a lot of references, a great reference to have if you're educating someone about strength training as a young athlete. And then finally, the National Strength and Conditioning Association is also a good website to go to for any information, further information. And that's it. So thank you.